Good evening, everybody. Thank you so much for logging in to listen to very interesting speakers who are going to share of their experiences tonight on living with dementia. My name is Shenton. I'm from Grandad Together. So tonight, our webinar topic is understanding dementia care and supporting the people living with dementia. But what is apparently? Apparently is a series of panel discussions between people across generations, bringing their professional and personal perspectives to help strengthen intergenerational families. Tonight, we are very grateful for the partnership of Dementia Singapore, as well as Oscar Fund, which is stewarded by Temasek Foundation. We also have support and partnership with Mums for Life, Dads for Life, and SG Families. So who are our speakers tonight? Tonight we have Bernard Lim from Dementia Singapore. Now Bernard joined Dementia Singapore in 2022 and he has been bringing 20 over years of experience in the media and entertainment industry to his current role. And being the director for advocacy, I think that suits him very well. Now Bernard has been bringing in all the creative juices that he has been expanding Dementia Singapore's efforts to raise awareness of dementia, which includes spearheading the groundbreaking advocacy and fundraising efforts that had featured top international acts like MLTR, Michael Learns to Rock, and Richard Marx. Now after Bernard speaks, we are going to have very interesting sharing as well from Mr. Chow and his son Don. Now, Mr. Chow is 82 years old and he lives with Alzheimer's disease and vascular dementia. He had been diagnosed with this condition in 2010. Now, Mr. Chow is a father of three, two sons and a daughter, and he's a proud grandfather of 5 grandsons as well as granddaughter-in-law. Now, before his retirement, Mr. Chow worked at Sembawang Shipyard for over 40 years and he was also involved in community, serving as a volunteer with his neighborhood's RC for close to 30 years. In that regard, he's even taught Qigong as a trainer with the People's Association. So now Mr. Chow is fully retired and he spends his days enjoying a simple, carefree life. But who is his caregiver? So Don, his son, is the caregiver for Mr. Chow and has been doing so since 2019. So without much delay, I will hand over to Bernard to share his perspective of how Dementia Singapore supports and cares for persons with dementia. Over to you, Bernard.
Thank you very much, Shenton. First of all, I want to thank you for doing this. I think it's a very, very wonderful thing that we're connecting with as many people as we can, as we share about all the little things that we know about dementia. And good evening to everybody who just joined us. I think today I'll try to keep the talk as best as I can to some of these topics. And this is a topic that was given to me by Shenton when we're planning this, to really understand dementia care and really support the dementia community. This is very, very important. I think the first question I often get asked, even recently, as recently as last week, somebody came up to me and asked me, Bernard, is Alzheimer the same as dementia? I mean, this is a really interesting question because I think about 3 years ago, before I joined Dementia Singapore, I would probably ask the same thing as well. So I think in many cases we learn as we go, and I just want to clarify that actually Alzheimer is just one of the types of dementia. So Alzheimer clearly is the most well known because it's the more common types of dementia that many people get diagnosed. So I start with sharing with you what exactly is dementia. So dementia, to be very fair, is an umbrella term that describes a wide range of symptoms, obviously changes in behavior, difficulty in planning, and also to a large extent memory loss, as what many people would know. And as you see on the green box there, Alzheimer's is the most common. It happens about 60 to 70% cases, as Mr. Chow himself is diagnosed with Alzheimer's disease. And because chemical changes in the brain and the cell kind of cause a bit of a destruction, and therefore this eventually affects a person's cognitive power. And in Singapore now particularly, there's also an increasing number of vascular dementia. Now, vascular dementia is what we most commonly will associate with strokes. So typically, if somebody, especially a slightly more elderly person, is diagnosed of or rather is suffered recovering from a stroke attack, the person doesn't recover well. There is a chance that the person can develop vascular dementia, and and then many other types of dementia, like Lewy body dementia, frontotemporal dementia. Frontotemporal dementia is what Bruce Willis, die-hard actor in Hollywood, he's suffering from that as well. So he's not living with a frontotemporal dementia. He has stopped acting already. So these are the different types of dementia. There are many, many other types, but these are the few common types of dementia that we often associate and we often tell people. So this is a very interesting picture that I often like to share. On the left side of a program, of the photo is a person's scan, the brain scan of a normal person, whereas on the right side is a scan of a person with Alzheimer's disease. So as you can see, those circled yellow little plaques are what has been caused. They've been formed in the person's brain, and therefore these are the plaques that is causing the disruption in the person's cognitive function. Numbers of dementia, this is something that I often like to share. And for many of us who are kind of watching this particular webinar, I think these are numbers that you can rattle off with your friends, if you have a cup of coffee the next time on a social setting. These are real numbers that I kind of brings a picture of the dementia situation in Singapore about closer to home. Presently there are 100,000 people living with dementia right now in Singapore. That is what we all know. There's courtesy that's told to us by AIC, which is Agency for Integrated Care. This is by Ministry of Health. This number is expected to go up to 152,000 in just about 4 years. So you think about it, it's quite an alarming number in the sense 152,000 will be living with dementia in about 4 years' time. And if you look at it on the other side, in 2030, also in 4 years' time, 1 in 4 people in Singapore will be above 65 years old. Now, we are an aging population, therefore, we know that this is going to be a situation that we're all going to be very concerned about. All right. If I go down at the chart on the left side, 1 in 11 people right now, age 60 and above, have dementia or may have dementia. 1 in 11, all right, amongst those aged 60 and above. But we go a little bit older, the age demo of 85, 82, 80 and above, 85 and above, the numbers is pretty scary. It's about 1 in 2. So that's 50%. So whenever I talk to some of my friends, I will just mention that if you visit your grandparent and the grandparent nags at you, then the grandparent, Akong or Ama, is very blessed because the person is not one of the 50% in that sense. And also in Singapore, the situation of looking after a person living with dementia is also a concern as well. We did a survey last year with a Pure Profile, interviewing some of our clients. Typically, it works out to about $24,000 a year to look after a person with dementia. And if you divide by 12 months, it's about $2,000 addition in a month expense. So these are all very clear concerns by our community. And the last bit I want to share is the last info on the right side of the screen. These days, dementia do not just affect persons who are 65 and above. Typically, people who are diagnosed with dementia who are 65 years old and above, but the last maybe 5 to 10 years, there are many people who are diagnosed with dementia way below 65. We have a bulk of our clients are 50 plus, 50 to 60 years old, which typically in the past, they would not have been diagnosed with dementia. So it's affecting younger and younger people. One of our youngest clients is late 40s. So it's getting a little bit of a concern. So presently, about 3,700 people right now with a young onset dementia. That means they're all diagnosed below 65 years old. So these are numbers that you can help us to share with your friends whenever you have a cup of coffee. And this is just to bring that situation of dementia in Singapore closer to home for people to understand better. Because dementia is a bit of an invisible condition. So a lot of people don't realize that by the MRT train ride, the person next to you may be having mild dementia. You never know, right? So this is what we want to share. Okay. The other thing that I also want to talk about is okay, my slides now jam. What's going on? I'm going to the next slide. Okay. Okay. Symptoms of dementia. There you go. These are some of the symptoms that we often notice. Obviously, difficulty performing familiar tasks, which is something that we all know. That's where the person's typically, grandpa typically goes out to play golf every Saturday, but suddenly doesn't play golf anymore. So that's a bit of a concern from children and grandchildren, right? Loss of interest in hobbies, changes in mood and behavior, because a person who has symptoms of dementia may also change the mood totally. Memory loss, these are things that we all need to look out for. Misplacing things. Sometimes we hear stories from our clients of how they leave mobile phones in the fridge. These are things that we laugh about when we hear it, but in reality, these are signs of a person going through dementia already, having signs. Stages of dementia, once you're diagnosed, and we always encourage the community to send their elderly parents or their relatives to the polyclinic. Reason why we suggest that is because at the polyclinic, once you're diagnosed, you are part of the system. Your records are tracked there. So therefore, social workers can help and they can refer you to hospitals, etc., etc. So I think that is a easy way to encourage people to come for diagnosis. And in fact, we also know that many of the elderlies do not come for diagnosis of dementia, unlike other terminal illnesses. So we also want to encourage more people to come forward to have themselves diagnosed, have their parents diagnosed. Yes, dementia, there is no cure, but we also hope that the fact that they are diagnosed, this person can come and join maybe any of the care centers to keep themselves socially engaged and just uh, prolong the deterioration of the condition. These are all very, very good advice. Stages of dementia, mild dementia, typically when you're diagnosed, obviously, forget event, becomes very withdrawn. Like I said, at the dinner table, doesn't want to engage in conversation. So these are very clear things as well. Then it develops to a moderate dementia case whereby you tend to repeat your words and kind of lost track of time. Typically that joke of how Ama would say, "Le jiak ba bui, le jiak ba bui," keep on asking three, four times in the conversation. Those are signs of dementia as well. And for very severe cases, this is where it gets really, really severe, where you are unable to recognize family members. We often hear that as well. When children visit their parents, they're not able to recognize who they are, or they mistake their daughters as their wives, etc., etc. So these are some of the things that happens for people with the severe dementia cases. Some of the risk factors, as I mentioned just now, this is not meant to be a gloomy chat. A webinar. Obviously, dementia, there's no cure, but there's certain risk factors that we just want to highlight that we can do for ourselves, or we can encourage our elderly to also take note of some of these risk factors, just to bring down the risk factors themselves. You know what I mean? In Singapore, these are some of the modifiable risk factors. Singapore, we're pretty safe. We are fairly clean, our air here, so we don't have a severe air pollution problem. That is one of the causes as well. If you smoke, we encourage you to cut down your smoking, preferably don't smoke, because smoking is one of the recognized causes of dementia. And excessive alcohol consumption. Notice the word excessive. I think most of them have a glass of wine or a glass of whiskey once in a while, but let's not try to binge when it comes to alcohol consumption. And infrequent social contact. That's also something that we should look out for our elderly people, so that we know that we should bring them out to be involved more with social activities, just to be part of the community. Under the health group, I just want to bring up this thing of hearing impairment. I think hearing impairment is something that many of us never really realize that is also one of the possible causes. Because if an elderly person can't really hear properly, it's very hard for the person to be engaged. You know what I mean? When people are talking, they can't hear what's going on. So my late dad, in his last years before he left us, he had very, very severe hearing problems. Well, he was blessed that he never was diagnosed with dementia, but he became very angsty and all that. So hearing is a very, very important risk that you should look out for. So I suggest that you try to do your best to bring your elderly relative, your parents, to go and have it fixed. Get some hearing aids and all that, visual impairment, the rest, so on and so forth. Now, I just want to mention this last one, less education. Now, I asked my doctor friends, why is it a reason? So, I mean, the answer is very simple. I said, when you are educated, regardless of what language you are able to read. And when you're able to read cognitively, you're more engaged. Now, let me give you another example. My mom lives alone ever since my dad passed away about 3 years ago. So we all were quite concerned. So we asked her, and she said, "Oh, don't worry, I'll be all right. You just subscribe Straits Times for me." So which we did, and I fixed CCTV cameras at home. So every morning I look at her. She's reading the papers, front cover to cover, every morning without fail. So obviously she is still very cognitively very, very clear. So education is one of the things that we tell people to kind of to get yourself cognitively engaged as important. Some of the non-modifiable factors, yes, people often ask me, Bernard, is it genetic? I mean, there is no clear proof that it's genetic or not, because there are more than 20 genes can affect a person's risk of developing dementia. Like the gene ApoE is the first known to increase a person's risk of developing Alzheimer. And the last column, gender, women are more likely to develop Alzheimer's disease. No clear reasons, not entirely clear, but a doctor friend commented maybe women live longer. So that was the only reason that he shared, right? Yeah. But these are some of the non-modifiable. So how to slow down cognitive decline? We always encourage people to really look out for these things, be active, do some walking exercises, strengthening exercises, eat healthily. As with all typical health conditions, you just have to eat healthily, less red meat, more fruits, and all that kind of thing. Have a more regular sleep hygiene as well. Avoid caffeine after 3 p.m., for example, regular sleep pattern. These are the things, these are pretty normal things, but these things help us to reduce our risk of getting dementia. Right. These are social circle. We have engaged in a social circle. We have a group of friends as well. All these active aging centers are important for the elderly to go. So you be engaged, you know what's going on around you. Practice self-compassion, which I think is also important. The fact that we want to be present at the moment. And I always say this, that if you never cooked before, maybe you learn some new cooking skills or sewing, whatever. These are all very important for elderly as well. Okay. Now, how do I communicate with a person with dementia? We always share this, and I always tell people these are some of the things that I encourage you to do. Attract their attention, speak slowly, the low voice, and obviously use very short sentences, or allow time for them to react so that they'll be able to understand what are you trying to do, that you're trying to help them. So these are some of the things that we share when we talk to someone with dementia. All right. We are trying very hard in Dementia Singapore to build a dementia friendly community so that everybody is comfortable to go out and not feel uncomfortable at all, right? So we have many programs. This is one of our programs that we encourage people to look out for, Dementia Hub, which is a portal of very, very good information. It's available in English, Chinese, Malay, and Tamil. These are all information prepared by Dementia Singapore that we encourage people to read. And these are articles that we focus on, the resources, the services that we have, and these are the angles of the story that we write. Living with dementia, my loved one has dementia, etc., etc. That is Dementia Hub, all right, which is a very, very important portal. And the other very important program we encourage people to look out for is to be, okay, this is the QR code. If you can scan the QR code, the green one, it will take you to dementiahub.sg. You can read all about it. And the other one is in Malay as well. Okay. Then the other thing that I want to share about is our community app called Cara, C-A-R-A. Now, Cara is a very is an app that we have that creates a dementia community in Singapore. So this is a membership program. It's a digital platform. It's available on your mobile phone. Download the app. Launched 2021. 3 categories of people joined Cara: persons living with dementia, their caregivers, and certainly members of public as well. All right. So it's a free app. Join as a member. So this is a breakdown of the people who have joined us. We have about almost 14,000 members right now. Person living with dementia is PLWD, caregivers 30%, members of public is MOP about 47%. Almost half of our members are members of public. Right? Okay, so key features of Para. Para is a very important function. It's about the safe return. A person with dementia joins this app, gets a card, a physical card, as you can see, there's a QR code there. The person is missing and the person is found. Whoever is this member of public can just scan a QR code and be able to contact your family member. All right. And this is what it is. If you're a person, you can also report your loved one who is missing. And this message will be pushed out to the 14,000 members. And this is amplified by the One Service app, which is more than 500,000 users around. All right. So this is what it is. And we have also recently launched a dementia go-to points. This is working with AIC. There are 800 dementia go-to points right now, meaning to say that if you see a person with dementia in this outside the public in the street, you want to help the person, you don't know where you are supposed to go, where is the dementia go-to point, go into the Kara app to tell you where is the dementia go-to point. All bus interchanges are dementia go-to points. That means somebody is trained there. All MRT stations are dementia go-to points. Somebody will be trained to look after them. We do our outreach go around, spreading the word about how this app is so useful, how it can help the dementia community, and that's exactly what we do all the time. All right. And today, I want to encourage everybody to scan this QR code. It is free. Don't scan. Don't be afraid. This is a free membership. Scan this QR code and sign up. It will take you to the Kara app, and you sign up as a member of Kara, sign up as a member of public. And guess what? Because Shenton is so nice to all of us, right? For this time, if you sign up as a Kara member, free of charge, Dementia Singapore will present to you a 1 year free subscription of any of the SPH Daily digitally on your app, on your mobile phone. We will give it to you. So just sign up as a member right now. Be a Kara member, join as a member of public, whether it's Straits Times, 联合早报, Berita Harian, or Tamil Merasu. We'll give it to you 1 year for free. All right, so this is not a scam. So scan this QR code, and then we're very happy to have you part of the community, and we do your part to support the dementia community, which is really what we do. I think dementia community is a group that we really need to extend our help. And obviously, Dementia Singapore, we're trying our very best, but we also know that we need all the support from the community. Dementia Hub, as I mentioned, Kara is one of them. We have a hotline, 63770700. You can get it on the Dementia website, 63770700. That is our Dementia helpline that you can call us. Any questions you have, and they all go to dementia.org.sg, dementia.org.sg. We'll be able to have all the information about dementia over there. Yeah. And if you need to reach out to me, these are my particulars. You can send me an email and let me know what are some of your thoughts and see how we can continue to support you. And really thank you once again for being part of this webinar tonight. And we certainly hope that we have enlightened you a little bit. Remember to show greater empathy for people out there when you see them. Okay. Thank you.
Thank you very much, Bernard. Wow, that was a lot of information, but very useful, very interesting. My takeaway are two actions. One is to check out dementiahub.sg for all the resources that are available. Number two is to sign up for the Kara app because we will be doing our part for our society. Thank you, Bernard.
Thank you. Thank you.
We're now going to switch over to Mr. Chow and Dawn.
Oh,
Good evening, Mr. Chow and Dawn.
evening. Good evening.
Thank you so much for joining us.
This is Mr. Chow. This is Don.
Yes, amazing. Yes, and we are so grateful that you have come on our webinar to share your lived experience with us, as I think many people, many families are facing challenges just like yours, and they just want to hear from you, your perspective. So perhaps we'll just have a dialogue, if you don't mind. So one of the things that I was so curious about is hearing Mr. Chow's very interesting background, a Qigong trainer, involved in residence committees as a community leader. What was that journey from suspicion of a symptom to a diagnosis, and how far down that journey are you at today?
Okay, Mr. Chow, can I share about your situation? Yeah, thank you, Mr. Chow. So I usually address him Pa, but he also likes me to address him as Mr. Chow, you know. So I only became Mr. Chow's caregiver from 2019. Prior to that, my mother was the primary caregiver. She was the first one to notice something different with Mr. Chow. The first sign was memory loss, and that prompted her to consult with the family, and we decided collectively that we should seek professional opinion. And that's when we went to the polyclinic and got referred to Tan Tock Seng Hospital, NNI, for further consultation. And we went through MRI and a series of checks. And the doctor at the time, I diagnosed Mr. Chow with Alzheimer's disease and vascular dementia. So vascular dementia, I know that earlier we mentioned it's related to someone who might have survived a minor stroke. It's also at risk is also people with high blood pressure. So Mr. Chow was prior to that diagnosed with hypertension. So he was diagnosed with both types of dementia. But he continued living his life, continued to serve the community as much as he can, right? And continued to teach Qigong as well to neighbors in the community. Until such time where we realized he could no longer perform what he wanted to do up to the level that he wanted to. So he decided to take a step back and pass on the baton to the next generation. Yeah. So during those times, my mother and Mr. Chow were both very active. Even retired, they were still actively joining Qigong classes, karaoke sessions, and very engaged with the community. Unfortunately, at the beginning of 2019, my mom suffered a heart attack. She passed on suddenly. So that brought about a very big impact to Mr. Chow. And shortly after, COVID happened. Yeah, COVID happened. So there was lockdown. There was a lot of things that was going on. So from 2019 onwards, the family had to pick up all the pieces. Because prior to that, my mom was the primary caregiver. And then we were trying to figure out what was the best way to care for Mr. Chow, what kind of arrangement would work for him. Something I want to share here is that Alzheimer's disease, vascular dementia, or other types of dementia will affect different people differently. Yeah, it will manifest in different ways. That's why it's a journey. Right? So initially, Mr. Chow started off with mild stage, and then it progresses as time goes on. So during the 2019 to perhaps 2022-23 period, we were trying to figure out what's the best combination to care for Mr. Chow, because at that time, we went through a lot of challenges trying to stabilize Mr. Chow's condition. With a lot of help from medical professionals, from Dementia Singapore, from the family as well, we were able to find a good balance to manage some of those symptoms or some of those behaviors that you might see. And so I believe right now we found a good balance for Mr. Chow, where his behavior is well managed and he's happy. Would you say? Yeah? Yes. He's happy and he feels dignified, right? Living his life. And we want to maintain this stability as long as we can. Yeah,
that's wonderful. I was curious about how you manage the lifestyle right now, and can I just check, is it a routine that becomes familiar with Mr. Chow that really helps, having a routine so that what is expected the next hour of the day is well informed and there's no surprise? Is that one of the good things to do, to have a routine?
Yeah, I think having a routine is very important, so that person living with dementia will know what to expect. In a familiar environment is very important as well. I noted that, in the first few years of changes after my mom passed, I try to imagine myself in Mr. Chow's position, right? What will happen? How will I react if I wake up one day and I cannot recognize where I am? It's like, okay, where am I? Right. So different people will react differently, right? Some people will feel unsafe. Some people will feel anxious, nervous, and therefore they behave in whatever way their defense mechanism might appear. Right. So there is a term that I learned from Dementia Singapore, which is person-centered care. We tailor the care according to the person, because one strategy that we apply on person A might not work on Mr. Chow, right? What suits him well might not work on other people. So we were trying to go through all the different routines, different ways to look for something that worked well for him, right? And it was also, as I mentioned earlier, dementia is a condition that progresses over time. It was 2 years ago when we realized, because of, I believe it's the effect of COVID, that Mr. Chow's condition progressed quite a bit, right? It's okay, I share, Mr. Chow?
Yeah.
Go ahead, thank you. So he was starting to shut down. Shut down meaning withdraw away from social interaction and start to isolate himself, right? Don't want to go out, don't want to engage in any activities.
Can I ask, is it also because during our COVID circuit breaker, we all had to stay at home, and that created the conditions to have the dementia progress? Is it because of the restrictions in social interaction?
For me, I believe that's the case. Because prior to that, he was very active. He was still, even though he was living with dementia at a mild stage, he was still very much engaged with social activities, joining his Qigong classes. He was going out, right? But after that, once we reopened, he started to withdraw. He started not to engage. That was one part of it. The second part of it is also because his condition has progressed. It actually affected the way he interacts with people. Okay, one thing that Bernard mentioned earlier: how do we communicate with people living with dementia? I think once the communication breaks down, there's a lot of frustration on both parties, the caregiver and the person living with dementia, because I don't understand his needs, and he's unable to communicate his needs to me. When there's a breakdown in communication, emotions start to escalate. Yeah. So something else I'd like to share also is, at the beginning, when people realize that, oh, Mr. Chow is different, Mr. Chow is living with dementia, I think majority of the people don't know what to do. They don't know how to engage Mr. Chow. They don't know how to talk to him. Okay.
Could you share with us what are some of the good practices to help us communicate with persons with dementia?
So Chinese New Year is around the corner. I'll give you an example. Chinese New Year is around the corner. Usually family gatherings, we enjoy going to family gatherings, right? Extended family and so on. As you can imagine, it's very noisy. There are lots of people on a table. There could be multiple conversations going on at the same time. This is a classic example of a chaotic environment for Mr. Chow. Because there are so many things going on, he cannot follow. It's just all the action-packed conversations are happening. And then when somebody suddenly throw a question at Mr. Chow, it's like, yeah, he goes into the abyss because he can't follow what's going on, right? So I learned, right, through programs with Dementia Singapore, I learned to moderate some of these gatherings. I become like a facilitator, you know, like yourself. I said, okay, so one of the first thing I did was to attend courses, attend talks, to empower myself with the knowledge, right? To expect what to expect, you know, as the condition progresses, so that I can share that knowledge with my family, his friends, our neighbors as well, right? I think knowledge is power. So the more people understand the condition, the more they learn, right? More willing to learn how to engage you. I think in the beginning, people were fearful because they don't know how to engage. You know? And then I want to also talk about young people here, right? I always share my knowledge and advocate with my family as well, right? Even my sons, my nephews, nieces, so on, so that they know what to expect, they know what to do, right? And I just completed a very interesting project with Dementia Singapore last month. We ran a 4-week project with ITE students, right? Students from ITE. They were going through 4 weeks, not 4 weeks, so 4 Saturdays of workshop with us, interacting with Mr. Chow, working with Mr. Chow, interviewing him. So one of the things we say is, okay, speak slowly, keep it simple, one instruction at a time or one question at a time. Give him time to process, right? When he has time to process, he will eventually come back with something. Okay, he might not have all the words to articulate well. So that's where we need to try to connect the dots.
Can I ask if there are any types of questions that family members or friends should avoid asking? And I'm asking because when my late mum was living with dementia, we asked if she had had her lunch, and she said no, but actually she had it 5 minutes ago. I've got also another relative who lived with dementia, and he displayed anger, violence, was shouting at people. I'm not sure what is the range and how do we sensitively manage our family members. Do you have any advice for us?
Yeah, I think different people will have different triggers, right? So for Mr. Chow, in the past, his trigger was, I share, okay?
Yeah,
yeah, thank you. You don't remember me, can you remember my name? You know, I told you this long time ago, you know, last week I just talked about this. So in a way, I find that this is like, there's no need to test a person living with dementia, right? It's very clear that a person living with dementia will struggle with memory, yeah, will struggle with organizing, planning, yeah. So there's no need to test them or keep testing them. Imagine if not just a person living with dementia, right? If it was one of us, somebody repeatedly, oh, your handwriting is awful, keep repeating that to me, that might trigger me also. I would go off in different direction, and you know, who knows what I might do, right? All of us have triggers, okay? So likewise, a person living with dementia has triggers too. And I think having that deeper level of understanding about what challenges a person living with dementia and be sensitive to that and avoiding those kind of triggering questions might help, right? And then to your point about maybe more aggressive behaviors, again, there is always a trigger. Something might have triggered that behavior. Unfortunately, a person living with dementia might not be able to accurately vocalize what they are going through, what they are experiencing. So last year, through Dementia Singapore, we were able to go on a trip, a 3-generation trip. So myself, my father, and my son, 3 of us went on a trip to Batam. Okay, I don't know if you can imagine the stress that we have to go through, go through the immigration, security checks, checking into the hotel, visiting all the different attractions, and then in the evening, retire to our room, making sure he has a good night rest so that we are ready for the next day. So having my son there was amazing to to help me.
Yes.
To
I'm
help
sure
me.
it was an amazing time
Yeah.
of bonding
Yeah.
among the
Thank,
three generations and to demonstrate the love that you have for each other.
yeah.
Wonderful,
Thank,
wonderful.
thank you for doing that, Don. That I just want to affirm you. I think it's wonderful, and the experience of having three generations spending time with Mr. Chow, I think is very nice of you. I mean, the way you describe how as a public, as a we how we show and support. I think there was a caregiver once asked me, Bernard, do you think the person living with dementia deserves sympathy? And I thought, yeah, I think so. And then this caregiver told me actually, but they do not just need sympathy, they need empathy far more than sympathy, which I thought, and I always remember that comment really stayed with me that as a community, as members of public, we show our empathy. So we understand how to react. And how do we understand means we read up more, we join webinars like this so that we are more knowledgeable about the condition of dementia. Then we can support. If we don't know, we don't know how to start, right? So I think for everybody joining this webinar right now, I think we can support by showing greater empathy. So then we know what sort of situation the caregiver, in this case, how Dawn feels, for example, in a public space and all that. So we should all really support you in that sense. And I really think that showing empathy is very important for the public.
Yes, yes.
Yeah.
I have a question about the person living with dementia, either Bernard or Dawn or Mr. Chow. Can the person living with dementia actually express and say, I'm sorry, I can't remember? Are they able to express that?
Can. I'll give you an example. Recently, we had another family gathering. So I think we are getting there, yeah? I think we are getting there. It's not all negative, but I think we are getting there.
Mm.
So in a recent family gathering, I see his juniors, right? My generation as well as my other generation, coming up to him and saying, hello, how are you, uncle? Or how are you, granduncle? Can you remember my name? And he said, sorry, I cannot remember your name, but I think you are my junior, right? I think I can remember your face, but I cannot remember your name, was what he said. And that was okay, right? That made the people who initiated the interaction feel confident to have a further conversation, So that, to me, that was wonderful, because I've never seen that happen before. So that was before that. We tried. Mr. Chow tried not to attend any family gathering, but now he's looking forward to the next one. So that's really wonderful. You made him feel welcome, made him feel understood, and as Bernard said, he felt the empathy. That was really important.
Yes, we are getting there. We're getting there.
Yeah, getting there. Yeah.
Yes, yes. And perhaps we go to some of the questions that have been posed by our audience members. One of them is whether there is any way to get tested. And I believe, Dawn, you had already mentioned that your first stage was going to the polyclinic, and from there the polyclinic directed to the hospital. So that was helpful for you.
Yeah, if I may jump in here, I think early diagnosis is important. Then we have time to put in place the support structure, the intervention that's needed to slow down the progression.
Thank you for saying what I want to say, Don. I think early diagnosis is very, very important. We're encouraging more people to come forward and to be tested. And truthfully, I mean, if you diagnose, then obviously we can plan how to support the person. I mean, otherwise we will not be able to help, you know. So I agree, early diagnosis is important.
Mm, mm. Yeah, there's another question which perhaps I can just explain to our audience members that the correct way to address persons with dementia is to say persons living with dementia or persons with dementia. We no longer use the word demented, it is not
Yep.
so appropriate. Yeah. So there's a question about caregiving roles. Perhaps for Dawn, have you considered like hiring a domestic helper, or would you reckon a family member is more appropriate to look after persons with dementia?
I can tell you very honestly, I cannot function without our helper. I cannot function without our helper. She is so important to making this family operate. So important. And at every opportunity where I find available resources, either training, workshops that are targeted or focused to the needs of domestic helpers, I would give that opportunity to our helper so that, she would learn as well, right? She would know how to care for a person living with dementia. I think that is also important for me. I can't say for other families. Maybe other families can manage. I don't know. Every family is different.
Yes, yes.
But it does take a village to look after a person with dementia. It does take a village. So it is, the more help, the better. Obviously, there's a primary caregiver, and there are obviously many other secondary caregivers as well. So it helps to have a village to look after a person.
There is another question about the grandchildren, and the question is, how would you teach and educate the younger generation on how to live with person with dementia? Say, for example, if the person with dementia is, say, violent towards the younger children, what could family members do to support or to address the situation?
Okay, if I may jump in here, I think with the behavioral issues, I think we need to stabilize that first.
Mm.
Okay, because when a person's defense mechanism is up, nothing will come through. Yeah, no matter what you do, no matter what you say, will not get through to the person with a very high wall, right? A defense mechanism up there. I think we need to address that first. So once a person feel that they are in a safe space, then the communication, the interaction can happen. So what we want to do, everything we can to make sure that interaction is successful. Okay? And also a lot of encouragement on both sides, person living with dementia as well as the younger person. I assume it's a younger person, yeah. So I'll go back to the example that I shared earlier about working with students from ITE. That was their first encounter with people living with dementia. Okay, so we give them some pointers on how to engage with the person living with dementia, and then we let them loose. So let them start interacting with our loved ones. At the end of the fourth workshop, I was speaking to them. So what did you learn? How do you feel about interacting with person living with dementia? They say, oh, surprisingly, it's okay, right? I think a lot of people, stigma is another thing that we have to live with. Stigma. Because of what we hear in, I shouldn't say media, but reports of articles that give a very negative connotation to the condition, right? That might give people an idea that, oh, this is stereotype, all people living with dementia are like that, but no. I think we have to reset that thinking, right? Remove those glasses that we put on and really look with our own eyes, and learn to engage with them.
Well, perhaps this next question I can pose to Bernard. There's a question about flexible training that's available, some flexible programs. And the question is, how can we find out about flexible programs which don't start so early in the morning, runs for a few hours? I presume the request is for short, like modular type of
Mm,
programs.
mm,
Bernard,
mm.
perhaps what's available
Okay.
from Dementia Singapore?
Yeah, I mean, I've always obviously the courses that we have must be customized to people. So I think in some ways, we are trying the best as we can. So in order how to customize a certain timings or that I cannot comment right now. So maybe I suggest you should call our dementia helpline. Somebody can advise you, can give you a call back, and then you can say what are some of the courses you're interested. How can we customize the timing for you and all that lah. I cannot comment right now because it's done by my other teammates.
Okay,
These are
understand.
the academy people. Yeah, the academy.
Understand.
But reach out to us, call our hotline, or go to the dementia.org.sg website and find out a bit more and send us a message.
Yes, okay.
Mm,
Thanks, Bernard. The next question, perhaps to Bernard
mm,
again.
mhm,
Someone was asking about genetic testing because you shared earlier that
mm.
some of us are just predisposed. And is there something that we can do in genetic testing? Or perhaps I can combine this with another question like, the
Mhm,
person living with dementia seems to be very stubborn and doesn't want to go and see the doctor, perhaps is in a denial mode. What can
mm.
we do when it comes to helping them with their medical needs? Either Bernard
I,
perhaps and then Dawn can answer.
I I think obviously getting the person with dementia to come forward to be tested is obviously the best step to do. But it's a person that's come to accept the fact that maybe there's something not quite right with me. Maybe I want to be tested so that help can be given to me. Help in every sense, actually, the actual daycare center support, or could be financial support for the family. Those are very real situations that people feel helpless, you see. So coming forward to is the willing to come forward is the best, you know. So obviously, I know some people who also kind of bring their parents quietly to be tested and without them knowing, you know, I shall mention the details, but that is another way of doing it. Not advisable, but I think it's always good to have that conversation to persuade the elderly parent or the relative to come forward to test. You know, I feel that those are very good when you want to do this together. And we also hear stories of how a person with dementia doesn't want to come to a daycare center, doesn't want to join any of these groups, and refuse to join the daycare center. Why should I go? You know, I'm okay at home. You know, so those are examples that we don't encourage. In fact, we encourage a person to come forward and join a daycare center program versus staying at home with a domestic helper. You know, that there is little social engagement in that sense. You know, I'm not sure about you, Don. Have you got any input with this?
Yeah, I think it's a similar challenge in the beginning for us. I found out later, right? Okay, so we have moments, Mr. Chow and myself, we have moments where sometimes we can sit down quietly and I will ask him how he feels about certain things. And there will be times where he will be able to share what he was going through at that time. And those were very insightful, right? So what I gathered for Mr. Chow, I can't speak for other families, yeah, but for Mr. Chow, sometimes he felt judged. He felt it's always the people that kind of reaction that he receives that make him feel not dignified. Right? He's still a person, he can still feel. So in the beginning when Mr. Chow refused to go to those activity center because of those reasons, because of fear, right? So myself would attend the activities with him, our helper would attend the activities with him, so that he has a familiar person there, right? And then we will engage in the activities together with him. And nowadays, when I say, "Oh, we're going to Tiong Bahru for meeting," he will say, "Let's go." Tiong Bahru is where Dementia Singapore has some of their activities.
That's
Yeah.
wonderful, and
It's
becomes
just
a routine to attend activities
Yeah.
with Dementia Singapore. Yeah, there was a question from
mm,
another participant regarding how the person living dementia is very sticky to the sister. I presume it's because of the familiarity and there's a fear of
yeah.
launching out to like meet other people that are so-called unknown. Yeah, is that a symptom or how do we deal with that?
I think just now Dawn mentioned about how comfort familiarity is very important for the person living with dementia. So I think that's clearly one of the reasons a person like to be with someone that he or she is comfortable with, versus meeting a new person altogether, right? So we totally understand that. So some of our daycare centers, like Family of Wisdom, we do welcome caregivers to join in some programs because we understand that. And for the caregiver to be there, caregiver can be a domestic helper or the children or the spouse, we welcome that. So sometimes like what Don said, sometimes different people have different sort of reaction, different habits, different style, different likes, different dislikes. So we do need to customize to some of our clients in that sense.
How do we tell the difference between just symptoms of old age, like inability to perform activities of daily living, and is that very different from persons living with dementia and the kind of symptoms they present? How do we differentiate? Yeah, this is just old age. Oh, but that one is a symptom of dementia.
And then that's $1 million question. I
Million
cannot
dollar
answer.
question.
What I like
No,
to
no.
suggest is if there is a concern, get tested.
Get tested.
Go
Yes.
talk to your doctor at the polyclinic.
Yeah,
And
exactly.
they do have some checklists that they will go through,
Yeah,
right? And then
yeah.
they will decide whether to refer for further consultation or no need. Right?
Yeah.
Concern,
Yeah.
get tested.
Yeah, and I do urge if you want to be tested, go to speak to a polyclinic because as Dawn mentioned just now, you come into the polyclinic segment, you're tracked there. So whether you're positive, you're not, I mean there'll be support system there. From a polyclinic, they refer you to a hospital, etc., etc. So you're in there versus you go to a regular GP out there, you may not know what to do. Because a lot of people, many people who are being diagnosed, they also don't know what are the next steps. So they need to know where to seek help, where to seek support. So usually the social worker will come forward to support. So, I mean, there are also many other things you can apply for subsidy, financial support, all that. So being in the right, proper setting is correct, is important.
Okay, so I hear you. To seek professional and medical help is very crucial because they would also be able to point, perhaps with a medical social worker, to suggest the kind of support systems that are available for members of the public. Yes.
Yes.
I have one last question. Perhaps I could pose this to Dawn. If you could share with our audience, because Grander Together is all about strengthening intergenerational bonds and cultivating family values. Can I just have Dawn to share with us, why did you choose to be your father's caregiver rather than to consider other options like nursing homes or other professional care? Well, why did you choose to do it yourself, Dawn? Share with us.
Okay, thank you, Shanton, for the question. Okay, when I spend time with my father, it reminds me of the time when he was taking care of me, and I was growing up with him. So I want to take care of him with a heart of gratitude, with a heart of joy and sorrow. Why joy and sorrow? You know that living with dementia is a journey, right? It's also a very long, if you think of it from a different perspective, it's also a long grieving process. Because every day, something changes. Every year, we lose a little bit. Okay? So, joy when we have moments that we share together that we are happy about. Like having that conversation with Mr. Chow, right? Yeah. So I for me, I didn't regret making that decision, setting my priorities differently from before. So it has been very rewarding, and now including my children, right, into the whole process. Not there yet. It's always a work in progress, right? But we will get there. I always believe we will get there, right? And that preserves the value of a multi-generational family.
Thank you very much for these very lovely parting words. We have a lot to learn from Mr. Chow and you, Don. Thank you very much for sharing your time with us, and also for Bernard for taking this time to educate us on what Dementia Singapore does, what the Kara app can do for us, and how we get SPH products for free for a year. And most importantly, if we need resources, we can go to dementiahub.sg to find these resources. So thank you very much for your time and the love that you have shown to all of us in educating us. So in closing, ladies and gentlemen, I'd like to also announce that the next apparently webinar that we will have is about offering understanding and supporting families who are living with people with ADHD. It was interesting for me to find out that whilst many of us may have encountered the younger persons with ADHD, but we never really know if there are adults among our friends and family who also are coping with the effects of ADHD. So I hope everybody will join us once again. We will have a professional speaker who will tell us more about it. This webinar is on the 11th of March. It's also a Wednesday night, and the QR code is available on the screen for you to register early, and the Zoom platform will remind you when the time draws near. So before we close as well, we'd like to thank everybody for spending your evening with us, and we would like to wish Dawn and Bernard all the best in their journey in living with dementia and dementia family, friends and relatives. I would like to request our audience members, if you'd like to continue connecting with Grander together on our Telegram, on our WhatsApp, even on our YouTube or our social media platforms, feel free to scan this QR code that you see on screen, and it will give you a choice of how you'd like to connect with us so that we can inform you of other fantastic activities that we have arranged to support grandparenting and intergenerational families. So as we close this webinar, you will also be receiving a Zoom request for your evaluation of our webinar, and we certainly want to improve on how we conduct things. So feel free to share with us your ideas, your comments, so that we can continue to be a positive force for our community as we strengthen each family's intergenerational bond. So good night and have a wonderful rest of the week. Thank you very much.